Everyone, my topic for today is analyzing medical and alternative approaches for blood pressure control in adults living in the US. Well, hypertension or blood pressure is a silent killer. So we will begin by reviewing hypertension prevalence and impact in US adults. Next, we will explore Western medical approaches and alternative therapies for hypertension. We will then analyze these strategies and compare, following by a discussion on future direction and recommendation for managing hypertension effectively. Now we're looking at the slide overview of hypertension in the US adults, where it's a public health impact, where nearly half of US adults suffer from hypertension, indicating a widespread health issue. Understanding hypertension's scope is crucial. This section covers its prevalence, associated with risk factors, demographic variations, and the serious health consequences of uncontrolled high blood pressure. Here are the risk factors and demographics. Key risk factors include age, obesity, diet, physical inactivity, and genetics. Prevalence varies by age, ethnicity, socioeconomic status highlighted the need for targeted interventions. Consequences of unmanaged hypertension. Untreated hypertension leads to severe complications such as heart attack, stroke, kidney damage, and vision loss. Early detection and management are vital to prevent these adverse outcomes. Now we're looking at Western allopathic medical care mechanisms, efficacy, and safety. Western medicine primarily uses pharmacological agent to control blood pressure through distinct physiological pathways. This section reviews the common medications, clinical efficacy, and safety profiles. Medication include ACE inhibitors, beta blockers, diuretics, calcium channel blockers, each acting on different targets like vascular resistance and fluid balance to reduce blood pressure. Clinical efficacy and outcome data. Extensive clinical trials demonstrate these drugs effectively reduce blood pressure and cardiovascular events, improving survival and quality of life when used appropriately. Safety profiles and common adverse effect. While general safe side effects such as electrolyte imbalance, fatigue, or cough may occur, monitoring and dose adjustments help optimize safety. Alternative and complementary modalities, mechanism, efficacy and safety. Alternative approaches focuses on lifestyle and natural therapies. This section explores how diet, exercise, stress management, herbal remedies, and acupuncture and imaging, guided imaging influence blood pressure and their evidence base. Lifestyle intervention, diet, exercise, stress management. Lifestyle changes like DASH diet, regular physical activities, and stress reduction have proven benefits in lowering blood pressure and improving cardiovascular health. Mechanism of action, stress reduction, and automatic autonomic regulations, such as stress hormone reduction, like using guided images, which help decrease levels of stress hormones in the body, promoted relaxation and well-being. Well, if we incorporate guided image into our daily routines, we have to be consistent in practice. Regular guided image session help build a strong stress management habit for daily routines. The use of tools. Audio tools provide structured guidance, making guided imagery easy to follow and more effective. Herbal therapies and acupuncture mechanism. Certain herbs may modulate vascular tone and inflammation, while acupuncture may influence autonomic nervous system balance, potentially reducing hypertension. Evidence for efficacy and safe concern. While some alternative therapies show promise, evidence is variable and safety depend on proper use, interaction with medication, and quality control concerns. Remain concerns. Comparative analysis of intervention strategies. This section compares outcomes, explore integration approaches, combine Western and alternative methods. Direct comparison. Pharmacological treatment offer rapid blood pressure control, while lifestyle intervention, health and quality of life, combining both often yields best results. Integrating drug therapy with lifestyle and complementary treatment may improve efficacy and reduce medication dosages through required coordinated care. Challenges include medication side effects, adherence, cultural belief as access to alternative therapies, and patient education all influence treatment success. Emerging therapies and research into personalized medicine promise improve hypertension management. Clinical guidelines and health policy must adapt to integrated device approaches effectively. Developing evidence-based protocol for combining Western and alternative modalities can enhance patient-centered care and improve hypertension management. Policies should support access to effective treatments and educate patients on safe, comprehensive hypertension care strategies to reduce disease burden. Here are some resources that support adult patients in the US. Access to dietitian, educational materials, support groups, digital health and conclusion. Managing hypertension in the US, adults required understanding and integrating both Western and alternative approaches. We have come to the end of our thank you.